Good morning, everybody. I hope you're all well. Today, we are going to talk about breast care with amazing Dr. Susan. Let me introduce myself. My name is Anjali. I'm the Women's Health Movement Coach and the Nutrition Counselor, and as well as the platform founder of this platform. So, Dr. Susan is here. I'm going to So before we start, I'm just going to start reading her bio. I'm going to try again. Oh, here she is. Hello.
Hi,
Hello, Dr. Susan. How are you?
I'm good. How are you, Ange?
Yeah, good. Thank you. Thank you so much for being here.
All
Welcome.
good. Thank you.
Yes. So would you like me to read your bio, or you would like to say, do it yourself?
I can summarise a little bit about myself. I'm a general surgeon. I was born on the Gold Coast, lived here most of my life, and I have a special interest in breast conditions,
Yes.
including breast cancer. I spent a couple of years doing specific training to manage breast cancer patients in Canberra and Sydney,
Yes.
and I work at Pindara Hospital and Gold Coast Private Hospital as well. I've got two
Yeah.
little kids, and yeah, they keep me busy. Yeah.
Yes, they keep you on the toes, and especially
Yes.
on the school holidays, right?
Yes. Yes.
That's wonderful. Thank you so much for that. And before we start
Yeah.
the question, I would like to talk about the disclaimer, because this talk is all about to bring awareness and educational purposes. My tongue is not working today. Apologies. Um, and so if you need help, or professional help, please reach out to your healthcare practitioner, or you can reach out to Dr. Susan by yourself. All right. So, is there anything else you would like to add on that, Dr. Susan?
No, not specifically. I think that's a good thing to mention. Yeah.
Yes, always, because it's we can't give the specific healthcare advice because we don't know, because it is specific for different for every single person, right?
Yes. Yeah. That's
Yes.
right.
Yeah. So before we start the questions, we are starting the questions now. So many women hear about breast self-examinations, but
Yep.
there is often a bit confusion around how to do them correctly.
Yeah.
And could you please walk us through that, and how often it should be done?
Yeah. So I guess there's no real right or wrong way of doing things. And the most important thing is that women and men are aware of what their breasts look and feel like. Um, yeah, there are lots of different ways that people can examine themselves. And when you Google how to examine yourself as
Mm-hmm.
well, you'll find different conflicting things. So there's not really one perfect, exact way of doing things. What I'd recommend is to check your breast at least once a month. If you notice something, then you can check it more frequently. For
Mm-hmm.
women that are getting their periods, then trying to examine yourself a couple of days after your period has finished. Hopefully your breasts will be less tender. If you
Mm-hmm.
don't get periods, then nominating a day of the month. Some people like to do it on the very first of the month. That can
Yes.
be a good reminder to feel on the first. And the first thing we're going to do is we're having a general look at what the breasts look like. So it's good to be in a mirror where you can see yourself, and you can pop your hands behind your head
Yeah.
initially,
Like this.
and hands above your head. And then you're looking for changes in what the breast is looking like, if
Mm-hmm.
there's any rashes, any abnormal dimpling, any puckering of the skin, if you see any nipple discharge, any scaliness of the skin. And then you can put your hands on your hips and sort of push yourself forward, and then you can check yourself looking at each side to see if there's any of these changes. Then
Mm.
after that, when we talk about examining our breasts by feeling them, this is often best done when you're lying down in bed. So you can
Okay.
pop a little bit of a pillow underneath your shoulder and pop your head on a pillow. And then everyone's technique is a little bit different, because the main thing is to try to feel all parts of the breast. And this is sort of a breast model I've got here. This is one that's got diseases on it. But
Yes.
some people like to sort of feel in wedges, so that you're sort of feeling from the inside out.
Okay.
Whether you do it outside in, it's fine as well. Some people like to do little circular movements and just try to
Mm.
cover the whole breast. Some people go up and down. So you just
Mm.
pick a technique that you like. And some people will feel lumps. And it's good to know what's already there, because what you're
Mm.
really wanting to know is what changes there are. And if you do find lumps that you haven't felt before, or if you think there is a change to a lump that you felt, then you should see your doctor, because that may need further investigation.
Mm.
Now, we're not just feeling lumps in the breast, but it's also good to feel for lumps in the armpit area. So
Okay.
to feel that, some people lift their arm above their head, but that actually stretches out the skin and you can't really feel
Mm.
lumps that well. So sometimes just resting your arm on your shoulder and then
Okay.
using your other hand to actually feel underneath there, you'll be able to pick up lumps in the armpit a little bit easier. So
Oh,
you
okay.
should check both sides, but yeah, I think when you sort of stretch your arm out, it sort of stretches everything and you can't feel too much.
You would think when you stretch it, you will feel more, right? But
Yeah,
then,
but it
yeah.
actually stretches the skin out a little bit too much.
Ah,
Yeah.
okay.
So I guess it's
Interesting.
important to know what is normal for you, and to spend some time to know your breasts, because it's really you that will notice a change. If you feel some really hard, rocky things in your breast and you're a bit concerned, then you should see your doctor.
Yes, so I went to visit Dr. Marie Kekev,
Oh, yes.
and
Yep.
we came because I have been going through this something in my breast, but
Mm.
they scan or anything would they couldn't find anything, and so we are
Yeah.
trying to find the, but then we came to the conclusion that it would get tender coming towards my period, and
Yeah.
then after my period finishes the tenderness would go away. So
Yes.
at the moment we're keeping an eye on it, and it's been going on for a few years, but then there is no change in as such in the you know the timing as well.
Yeah.
So yeah, so she said we will keep an eye on at the moment, but we have to stay active and keeping an eye on it.
Yes.
So
Yes.
but anyway, so it was a relief.
Yeah,
So
sometimes it's good to see a specialist to have that reassurance as well,
yes,
because it can be very stressful being, being a woman, being a busy mum, and you've got that extra worry. So sometimes it's good to have a specialist see you as well.
absolutely, and it's just a peace of mind as well, instead of worrying
Yes.
about it and googling all over the place, and and trying to fix it yourself, right?
Yeah. Yeah.
Yes. So the next one is breast density is a term that comes up a lot in a screening result. So Dr. Marie really defined it for me, make it really simple, A, B, C, D, like that. So yeah, could you explain what it means, how it affects breast cancer risk, and whether women with dense breast need different screening approaches?
Yeah. So breast density, it refers to really mammogram pictures that are
Mm.
performed for patients. So breasts that are dense, they look more white on the X-ray, whereas
Mm.
breasts that are not very dense look more black. And the whiteness relates to how thick the breast tissue is really.
Yes.
And it makes it more difficult to pick up changes on a mammogram, because programs like Breast Screen, they rely on early breast cancers looking like little white dots.
Mm.
So when you have a lot of white tissue, when your breasts are very dense, it can be really hard to pick up those changes, those
Mm.
little white dots, because it can be very subtle.
Yes.
So the range A, B, C, D, people who are A and B, they have breasts which are more see-through. So there's more black tissue and you can see these changes more easily. Whereas patients that the tissue is sort of a bit thicker, a bit more white in appearance, it can be really hard to pick up those changes.
Yeah.
And that is why women who have dense breasts, they are higher risk of breast cancer. And some of that is related to being reassured when you can't really see through that mammogram appropriately. There are some tests which can help women who have dense breasts, because probably about, you know, 40-50% of women may have dense breasts, and it's not something you can necessarily feel.
Yeah.
And
Yeah, that is the
people,
same issue with
yeah.
mine as well. Yes.
Women who are younger, they do tend to have more dense breasts, but there
Oh,
can be
thank you.
often there can be some older women as well that have dense breasts, so it doesn't
Okay.
necessarily discriminate. That's the problem.
I thought you called me younger. So.
Yes, you're young. So there are imaging techniques for women with dense breasts, such as MRI scan with contrast and also mammograms with contrast. So it relies on these tests giving some dye, because where there are cancerous changes, that tends to leak dye. So it's not done all the time, but ultrasounds also can look at the breasts in a bit more detail to see if there's abnormal shapes, because there are characteristics that can be picked up with ultrasounds if there's suspicious lumps in the breasts, and then that may require a biopsy. It's hard because there's no real different screening that's recommended at present for women with dense breasts, although if you had a family history of breast cancer or ovarian cancer, that may change some recommendations. So talking to your GP if you've never had any imaging is important. If you go to breast screen, very soon they are supposed to tell you what your breast density is, because in the past they haven't. Some of the states are now telling people what their breast density is, because you may want to investigate having other tests to assess your own risks. Because the screening program with breast screen, they will do a mammogram, but previously they weren't able to tell people what their density was. So we're trying to encourage people to find out what their density is in case they wish to pursue other testing.
Yeah, if they're not happy with the screening, is that correct?
Yes, yeah, because dense breasts on mammogram, there may be a bit of a miss rate in not being able to pick up early breast cancers. Yeah.
Yes, thank you for that. So it is MRI, screening, and ultrasound.
Ultrasound, and there are also contrast mammograms. So you can talk to your doctor about whether that's appropriate for you if you've got dense breasts. Some of these tests do end up in people having further investigations as well, because they can be very sensitive in picking up various lumps in the breast.
Thank you for that. So there are, okay, so the third question that we were going to ask is and I think we touched on this already. So there are different screening methods available: mammogram, ultrasound, MRIs. How do you decide which method is appropriate for women and what stage of life? So I think we already touched on which method, but like consulting with your GP or the breast care practitioner, but what stages of life, at what stage? Yeah.
So I guess breast screen, women are invited from age 50 to 74 to have a mammogram every 2 years. That's just a standard mammogram. And if they find an abnormality, they may do an ultrasound, they may do a biopsy. Women who are 40 can go to breast screen. women who are 40 and less, the rate of pickup is less good because you may have dense breasts, and that's
Mm,
why they don't tend to tell you to go to breast screen when you're younger than 40. So
okay.
starting with an ultrasound if you feel a lump may be an appropriate way of investigating a lump, and then your GP can then decide whether you see a specialist, whether you have other investigations.
Yeah. All right. So they yeah, going to GP and then 40, 50 onwards,
Yeah.
but you can go for the yeah, scanning from 40 plus,
From
right?
40, you can ask for it, yes. Some
Oh,
people, when there's a very strong family history, um, then they may recommend to see people who specialise in high risk screening.
yeah. All right. So the yeah, thank you for that. And in your experience, what are some of the biggest myths or misconceptions women have about breast health, and how can we clear them up?
So I guess education is important to help clear up misconceptions. So some women think because there's no family history, they won't get breast cancer,
Mm-hmm.
whereas a lot of people actually have no family history of breast cancer. So 85 to 90% of people who get a breast cancer, there will not be a family history. So
Mm-hmm.
these people shouldn't just be falsely reassured that it couldn't possibly happen to them
Yes.
because of a lack of family history. Some people think that only women get breast cancer, which is not true. There will
Mm,
be a small proportion of men that get breast cancer, and if you notice something with a man's chest, you should tell them to get checked out as well, because they often present late because they ignore it, and again they think that couldn't
yes.
possibly happen to them because
Mm,
because they're not a woman. Um, a lot of women, when they feel pain in the breast, they worry that they've got breast cancer. And fortunately, breast pain, it's less associated, or it's less likely to be a cancer. I guess it's still important to be aware of things, but just because you've got breast pain doesn't mean you have a cancer. There can be other reasons that women have breast pain, as you were
mm,
mentioning, sometimes related to hormones. But changes should always be checked out. Some people think that if you're young, you can't get breast cancer, but breast cancer,
yes.
it can affect all ages, really. And just because you haven't been given an invitation from breast screen to have a mammogram doesn't mean you can't get it. And some women, when they sort of reach that cutoff of 74,
Yes.
they also think they won't get breast cancer, but that's not true. And they can still go to breast screen or have private imaging with their GP. So
Mm,
just because you stop being invited or haven't been invited, you still are at risk of
yeah.
having
So
breast
why,
cancer.
it's out of curiosity, why after
Mm.
75, you said?
74, yeah.
74. So
Yeah, they stop
why?
being invited. It's more of a, so it is a screening program. So the government want to do the best they can to try to capture the population that are more
Mm,
likely to have breast cancer.
yes.
But the risk of breast cancer is not zero once you turn 75. So
Mm,
women who are still older should still be aware that there is a risk of having breast cancer.
yeah. So they have to, we all have to, no matter what age or
Yeah.
gender, we should keep an eye on
Yes.
our breast care. So
Yes.
yeah, um, I didn't know the men could have breast cancer
They
until last
can.
year when I spoke to you, and that was the
Mm,
yeah, eye-opening time for me, because
yeah.
I'm sure there are lots of people who would think that I'm not a woman,
Mm,
only women would get it. So yeah,
yeah.
that is yeah, that's the big eye-opening time for me.
Yeah.
So how important is a lifestyle, diet, exercise, alcohol consumptions, stress management when it comes to the breast health and reducing the risk factors?
Yeah. Breast cancer, it's such a common condition, and in a lot of people where there's not a genetic predisposition, we really don't know what causes it. So
Mm,
trying to maintain healthy lifestyle habits, healthy diet, exercising, sort of moderate exercise, 30 minutes a day, avoiding alcohol, not smoking. They're all things that will reduce the risk of getting cancer and improve health overall. And because we don't really know what triggers it in some people, anything you can do to try to maintain good health is important. People who are overweight are at higher risk of getting breast cancer. But in my experience, I've seen people who are overweight, I've seen people who are of a normal body mass index get breast cancer. So I think doing what you can to try to stay healthy is important, because we aren't really sure exactly what contribution all these things do affect your health.
Yeah. So the other thing I wanted to ask, it's not in the question we put, but I was going to ask. So once you do the surgery, the management side of it, what would you suggest people to manage it and, try to keep a track of healthy living?
So if a patient has had breast cancer surgery, usually the breast surgeon helps coordinate the care. Now, depending on the type of breast cancer you may have and what surgery you've had, that may involve a medical oncologist, and their role is to determine if you need other sort of medication-based treatment to prevent the cancer coming back or to deal with the cancer that you've had removed. Some of them require chemotherapy, not all of them, and some cancers need other hormone blocking tablets, but again, not all of them. So that's their role. So part of your care may be involving a medical oncologist. Depending on whether you've had a lumpectomy or a mastectomy, and also how aggressive the breast cancer is, you may need radiation treatment after surgery too, and that's something that a breast surgeon typically coordinates and helps organise. And then having some other allied health like physiotherapists, occupational therapists to monitor for side effects of the treatments are also important. And then what normally happens is that at particular intervals, you'll see your specialists, including your surgeon, to monitor you to make sure the disease doesn't come back. That will usually involve physical examination, monitoring symptoms, and then breast imaging. And typically, specialists will follow up their patients for between 5 and 10 years, and that's really sort of how we look after patients with breast cancer, but sometimes other people may need to be involved depending on their journey.
So you do cross collaborate with the other practitioners to support the
Yes.
patient. Yeah,
Yep. And
that's
for
amazing.
monitoring, yeah.
Yes. So with the well-being side, is there anything you would suggest on the wellness side?
So some people find that different things work for them. Some people do like having alternative practitioners help with their care, which is fine as long as there's no major harm that's going to be caused. So everybody will, I guess, have a different experience. Some people like massage, some people like sauna therapy. I think having a close network of like-minded people is important. And it's important to have people supporting you because, again, women think they can manage everything and they might need some
By
more help.
themselves?
But yeah,
Yes.
and sometimes when you have a disease like cancer affect you, even though you are strong, you may not be as strong as you thought you were, and you do need some help. So I don't mind if people have other therapies as long as it's sort of helping towards them get better overall.
Yes. So does the patient need to check in with you before they do any different types of modalities? So
They
it's
they
not
can do.
controversial?
Yeah,
That,
we can always discuss that. They can also talk to their own doctor, their GP. Um, it depends if they're sort of talking about having supplements or other sort of physical therapies. Most things we can discuss, or they can discuss with their GP.
Because you don't want to, because sometimes we might think what healthy is or what good is might not typically support that. What sort of cancer do you have, you know?
Yeah, I guess we also don't want people to be misled and given false hope and to be ripped off either. So sometimes there are people that can unfortunately prey on people who are very vulnerable, and we don't want them to be wasting lots of money for therapies that aren't proven either.
Yes, so you have to be careful and
Yes.
stay close to your network and
Yes.
communicate, and then what is best for you, I guess.
I think so. Yeah.
Yes, thank you. So I think we can keep talking on and on, and yes. So if anyone has any question, please pop it in the comment section. While we're waiting, please, Dr. Susan, please let us know where people can find you and your services.
So I work at both Pindara and Gold Coast Private Hospital, but my office is based at Gold Coast Private Hospital. And if you wish to see me I work as a general surgeon as well. So general surgeon and breast cancer surgeon. Your GP can find me on Medical Objects, or you can search for me on Google.
Okay. Medical Objects.
Yes.
So that is the website for the medical practitioners?
Yeah, so the GPs, they can look up specialists via that program, which is within the practice software. Yeah.
Oh, okay. Yeah, good to know. All right. Thank you, everyone, for being here. Thank you, Dr. Susan, for,
Thank you.
As always, we've been doing this yearly. Is it your third time or second time?
This is my second time, yeah.
Yes.
But I think an important message to sort of say is that a lot of people actually don't have breast screening. I've heard about 50% of women actually won't have a mammogram, and whether that's because they're scared, or they've heard from other people it's going to hurt, or they just think it's not going to happen to them, or they get really anxious knowing what the results will be. I think it's important to be checked out because if it's picked up early, the treatment and survival is a lot easier for the patient.
Yes, I was, my reason I almost didn't want to do it this time, going to Dr. Marie, was it's been 4 or 5 years, and then, no one has found anything. So I was like sort of bit, oh, wow, no one is finding anything. So what's the point sort of feeling? Yeah. And then, I decided to go at the end. Yeah. But, I think sometimes people might be getting frustrated as well, not finding the answer. Yeah. In that case. But, thank you for the reminder. Yes.
No problem.
Because we are so privileged, here, because in Nepal, we don't have these services that the government provides, or the letter, reminder, text messages, right? Saying that, hey, your mammogram is coming, you book in the spot, or things like that. And we get that, and still we managed 50%.
Yeah.
That's
so
incredible.
breast screen is free.
Yes.
So there's no financial excuse, I guess.
Yes.
But if people want to screen with their GP as well, if they feel more comfortable talking to the doctor that's always sort of looked after them, then that's always an option as well to pursue private screening.
Yeah, yes. So everyone, listen up. Please do your breast screening. It's free. And, you always, and my GP, Dr. Fiona, was always chasing me to find the solution and not find the root cause of it, not giving up. And she wouldn't give up. And I was like, I will just have to do it. Otherwise, she's never going to leave me alone. Yeah. So, we have to, I guess, work both ways, isn't it? Not just one way. So we can take care of ourselves, right? So
to other people if you haven't looked after yourself. So you need to take time to look after yourself. Yeah.
Yes. No, lots of times us mothers, we're always putting ourselves on the backside, and then,
Yeah.
taking care of everybody else. And same with our husbands as well. They think they feel so much responsibility around their house and children, and they don't, like you said, breast cancer can, men and women both can have it. So, so take care of yourself, right?
Yep.
So how they was sorry with the men, they can go for the skin screen too, or like I mean.
Typically, no, they don't go to breast screens. So, um, if they notice a change in their breast, they would go to their GP. So,
Mm,
breast screen is more of a screening sort of program. And for women who've actually got a lump, they're best to go to their GP rather than breast screen, because if you've got other symptoms, other tests
mm,
are usually required. So, breast screen is usually recommended in women who are asymptomatic.
okay.
But if you've actually got a lump or a symptom, you should see your GP first to discuss that, and
Okay.
then they can organise
Yeah,
tests. Yeah.
anyone, men or women.
Yep.
Yeah, all right. Okay. Thank you. I was like thinking about what
No,
would
they
be
don't.
like
They don't invite men to
do they
breast
do,
screen. Typically,
like
no. See your
do they
GP.
get notification, the letter from the
No.
government saying that you have to go for the checkup? Okay.
No. That if that's breast screen is typically just for women.
For
So
women. Okay.
yeah.
Thank you so much. All right. We better
Cheers.
stop. We can better finish this.
Nice to
Thank you
talk to
so much
you.
for being here. I truly appreciate your time and all the knowledge you have shared with our community. Thank you, everyone, for being here. And I will
Thanks.
definitely see you in the next live, and maybe next year again, we will book you in. Thank you so much.
Lovely. See you
Thank
later.
you. Have a great day,
Cheers.
everybody. Thank you. Bye bye.
Bye.